Hello, my name's Dickon Hayne, and I'm going to present the SUBDUE trial. Those are my conflicts. Durvalumab's a monoclonal antibody, a PD-L1, and it is active in malignancies, including urothelial cancer. Suburothelial administration is not reported. It's an alternative treatment option. It may reduce side effects and have lower costs. It's a mode of administration of other drugs, which is already utilized by urologists who own this space, and it may be safer or more efficacious than systemic delivery in the non-muscle invasive setting. ANZUP developed this concept through the bladder concept development workshop process. It's a phase 1b dose escalation study with patients with muscle and non-muscle invasive bladder cancer scheduled for cystectomy. A suburothelial injection at the 3 predetermined doses is infiltrated into the bladder with 25 1 ml injections. This is performed at least 2 weeks prior to the scheduled radical cystectomy. So biopsies are taken immediately before the durvalumab injection, and then later on, immediately prior to the cystectomy. International Prostate Symptom Score and Illyria symptom scores were recorded at various time points, and other AEs recorded. Immunohistochemistry for CD3, CD8, CD68, and CD163 was performed, and we report relative changes in immune counts on the bladder biopsies from the stroma before and after the durvalumab injection. A value over 1 shows an increase in that immune marker. 11 patients were recruited, all underwent their planned cystectomy, and they were mainly T1 tumors, 2 T2, 2 TA, but most of them had concomitant carcinoma in situ. There didn't seem to be any impact on the symptom scores following durvalumab injection. There were some adverse events related to the procedure, which were all mild. 1 patient stayed overnight. There was a transient elevation of TSH prior to cystectomy in a couple of patients, which normalized without intervention. There was no hepatitis. In terms of the tumors prior to the TURBT specimens, 7 were luminal, 2 basal, and 2 mixed. And all of the basal and mixed tumors were PD-L1 positive, whereas only 1 of the luminal tumors was positive for PD-L1. The RCI did vary between the immune cell types in the stroma, particularly increased CD68, which is all macrophage, and CD163, so M2 macrophage, especially at the higher dose. The basal and mixed cancers seem to show a larger CD163 increase after durvalumab than the luminal. Monocytes were increased in the serum after the higher dose injection, and 1 patient with carcinoma in situ on the pre-durvalumab biopsies had a complete pathologic response. These are the relative immune changes. We can see the 3 on the left side of the figure, the 3 different doses, 25, 75, 150, with the increase in macrophage, the CD68 and the CD163. And when we compare those between the basal and luminal groups, there was a significant difference between the CD163 positivity in the mixed and basal group compared to the luminal group. So suburothelial injection of durvalumab was safe at all dose levels. There were no drug-related adverse events. The stromal immune infiltrates did vary after injection, and the macrophage increase seems to drive this difference, particularly CD163, and particularly in those with a basal component. All 11 patients proceeded to their cystectomy. They recovered well, and they're all alive without evidence of disease. Tantalizingly, 1 patient with pure CIS only on the biopsies prior to durvalumab had a complete pathologic response, including in the entire cystectomy specimen. So we think the study has outperformed our expectations, certainly demonstrating that it's feasible and safe and no immune-related adverse events. Further studies are clearly required with suburothelial PD-L1 therapy, and these are planned. Those are my acknowledgements. Thank you.